For the past 3 years, these young paramedics have been protesting against the lack of employment opportunities in Sri Lanka's healthcare system. They blame the health ministry of using the economic downturn as an excuse for not creating enough jobs for paramedical graduates.
The biggest issue is that the government is not recruiting for positions like paramedical staff, radiographers, physiotherapists, and medical laboratory officers, pushing the young people into more trouble. They failed to come to an agreement to fill these vacancies, even though qualified graduates have been waiting to join them for many years. The free medical system is collapsing in Sri Lanka.
In 2022, Sri Lanka faced its worst economic crisis since gaining independence in 1948, with the healthcare system being hit the hardest. Insufficient government funding for medical care pushed over 2,000 doctors, 10% of all doctors in the country, to look for jobs abroad last year. This exodus has left rural hospitals crumbling. 100 kilometers south of Colombo, at this hospital, there are only 3 doctors for a population of over 75,000 people. Today, Dr. Kaushalya is the only doctor on duty.
Can you turn and take deep breaths?
Every day she starts at 8 in the morning and works for at least 10 hours. The patient inflow is overwhelming. She can only spare 2 minutes per patient.
Every day we have to treat hundreds of patients. Some patients are coming from 20 kilometers away. This is the closest hospital in the area. Most of these patients come for the treatment of cough, cold, viral flu, and non-contagious diseases.
For Dr. Kaushalya, even a common ailment becomes a big challenge at the hospital, without the medicines and equipment she needs for the treatment.
We don't have emergency facilities. We can treat urgent cases, but we cannot do chest x-rays, blood tests, or CT scans. So we're forced to transfer to Colombo.
As a result, the National Hospital of Sri Lanka, the biggest in the country, has become overcrowded. Each day, around 5,000 patients travel from across the country to seek specialized treatment.
There are not many specialists here. Only 10 are available. I arrived at 8 a.m. and saw the doctor at 11. So I waited several hours just to see the doctor, and now I'm waiting for my medicine.
The hospital's deputy director, Dr. Belana, believes that patients cannot be given proper care unless there are major reforms in the medical services. For him, the main challenge is the overcrowding at the hospital.
Here we have a shortage of doctors even in the OPD. If the government can improve the infrastructure, the quality and the safety of the peripheral hospitals by making available doctors and the doctors being given more facilities in working in those areas, the situation will drastically change.
The country is also running low on essential medicines since the peak of the economic crisis 3 years ago. Pinuli Bimsara and her husband had to move from their village nearly 200 kilometers from the capital for the treatment of their 6-year-old daughter suffering from leukemia. But even here, she cannot find medicines on time.
All of last month, we didn't have the MPL medication. We couldn't even find the injection. It was not available, even in private pharmacies. At times like these, we become very helpless. I feel that the children need good medication and on time, regardless of which part of the country we live in.
Binuli's case became the new norm in the country. Many medical professionals, discouraged by worsening conditions, are now seeking better opportunities abroad. Sanjeevni is a head nurse at a private hospital. Despite working for 12 to 18 hours a day, she earns only $150 a month, barely enough to cope with rising inflation. She has now decided to apply for work permits in Switzerland and the UAE.
In our country, we don't receive any benefits for how much we work. The long hours can get up to 18, 24, or 36 hours per shift. When you consider the role of a caregiver, the recognition we receive here is pretty low. Nowadays, most companies cut down on salaries. They even cut off our overtime.
According to the World Bank, the country's economy is expected to witness a 2.2% growth by the end of 2024. While the health sector is still in the recovery phase, experts fear that if Sri Lanka can't slow the exodus of healthcare workers, the impact will be felt for years to come.